Hey everybody, this is Dr. Bailey here with another installment for my health psychology class. This time I thought I would go over that survey I had people do. If you remember, it looked a little bit like this. Meant it to be anonymous because I'm not trying to make fun of anybody. Most people got most of the questions wrong, and that was sort of the point I wanted to make about it. There were 20 questions and the average percentage correct was 27%. You're like, wait a minute, this is just agree, disagree questions. What do you mean I got them wrong? These are opinions. Out of the 20 questions, one of them is an opinion, but almost all the others, the 19 there's research that basically shows that there's kind of a right or wrong answer for the most part. So basically, if this one, number one, is football players wear helmets and it reduces concussions, that is not true. So if you put strongly agree, agree, slightly agree, or neutral, I called that wrong. You would have to at least put a slightly disagree, disagree, or strongly disagree. So that's partly how I ended up saying that we've got about a 27% accuracy on this little survey. This is the first question. So again, as you could see, actually only one person, 2.9% of the 34 people in this original collection. We tend to think that football players need helmets, in fact, there's millions of dollars, billions of dollars put into football helmet technology, and then every year the number of concussions goes up. And this doesn't make intuitive sense. Clearly, almost everybody in the class thinks so. Sure, this must help. But if you think about it, only people with a helmet would bother to try to tackle with their heads. Right? So part of this class is to demonstrate that our behaviors dictate our health more than we think. And here's a classic example that if you give somebody a nice protective coating on their head, that they will use their heads in more dangerous fashions. This is called the safety paradox. The more safe you feel, the more dangerous you act. So rugby players don't wear helmets and they get fewer concussions, partly because they're very careful about not making sure their head goes into the heads of other players. Football players didn't always wear helmets, by the way, and they had fewer concussions before helmets were brought in. How about number two? When the government passes laws, people just are going to do it even more, right? Like if you are told don't eat that cookie, makes you want the cookie even more and you're more likely to do it. So sorry, I tried to throw you a little bit by saying, oh, this is known as the cookie jar phenomenon, as if it's a real thing. It is not a real thing. In fact, when the government passes laws that restrict behavior, it absolutely decreases the likelihood that people will do something. If they pass a law about seatbelt use, then not everybody, but almost everybody wears seatbelts. If they say that a drug is legal or illegal, it absolutely has a tremendous impact on the number of people who use that drug. So this is what we got. Again, we only had one person get this one correct. So every now and then I'll show you kind of a running total, but you get the idea that we're not doing well off the first two. This one, actually, people did pretty well on. The more money a person makes, the less likely they are to drink alcohol. How about the more money a person makes, the less likely they are to smoke cigarettes? Well, the answer to these two questions are different. Richer people actually drink a little bit more alcohol. They have more money, right? And alcohol is basically a luxury expense for many people. We tend to think of kind of the hobo or a homeless person being a wino. There's a small stereotype there, but generally speaking, most people got this correct. It is true. I'm sorry, this is false. Most people knew that. They disagreed with this and said, more money you make, the more likely you are to drink alcohol is the research. But with the cigarettes, it's totally the opposite. In fact, there's a tremendous negative correlation. The more money you make, the less likely you are to smoke cigarettes is very clear. In fact, here's a little graph that kind of shows that people who live below the poverty line smoke at 32%. People who live at the poverty line, a little bit less likely, but if your average income is about twice the poverty level, then only about 16% of people It's a similar kind of graph for how much education you have. High school graduates or people who didn't graduate high school smoke on more than double. I think it might even be triple the rates of people who have a undergraduate degree. Oh, this one, most people get this one wrong. So people who work with the elderly can extend their lifespans if they really care for them. Now, I tried to use the phrasing very carefully here. That you anticipate their needs, make them as comfortable as possible, and then do their task for them. Well, that takes away their agency, right? That takes away their feeling of control. And it's way better to treat the elderly, for example, with being willing to help if they're asked. So if somebody says, "Hey, could you do this for me?" Absolutely, be a nice person, be a kind person. But this anticipating and trying to, life doesn't always need to be comfortable, and I absolutely do not do tasks for people if they're capable of doing them. That actually lowers the life expectancy. So most people, again, only one person. Just about everybody else missed this question. So now we're down to about 17%. Every year, the average lifespan in the US will continue to get higher and higher due to medical breakthroughs, and people will continue to live longer and longer. Well, that was true throughout most of the 1800 to today. There's been this tremendous increase, right? In 1860, people used to only live to be about 40. It went down to the Civil War. But generally speaking, we're talking about the average lifespan was 40, and now it's close to 80. And this is an opinion, by the way. I should point out we don't know about the future. I'm just suggesting that current research shows we have leveled out now. It might go up a little bit, but generally people tend to think of this will just continue, that we'll just sort of see this graph keep going up and up. And currently the research doesn't show that. Childhood obesity, for example, basically shows that kids born today are very unlikely to live as long as people who are 20, for example, or people who are 40. They were born back here where the lifespan was much higher because we didn't have as much processed foods, we had more exercise, and that's going to pay dividends when we're older. So only 8.8% got that one right. This is the one question where I'm not counting. I didn't grade it. This is absolutely an opinion question. Whether or not sham surgery should ever be done. My only point is that I think sham surgeries do play a role. Personally, this is my opinion. I've got a whole other video just about sham surgery, but wanted to point out that most people are against it and just sort of think, oh no, there'd be no way. I don't think it's that simple. I do agree with people who, I can understand why somebody would say that I still, after I know all the pros and cons, I'm still against it. That's fine. But in my experience, most of my students don't know the pros. And so that's a point I'm going to try to make in a future video. Good way to tell if you had a good workout is if you're sore. Men in particular tend to believe this. Soreness, muscle soreness is a sign that something is wrong. You did not stretch, you didn't drink enough water, you didn't rest after the exercise, like had a good night's sleep the night before or after a workout. Generally speaking, our muscles are trying to tell us something, like don't do that again. So muscle soreness should never happen. There's no need for it to ever happen. I had like a few coaches here at Limestone to learn that lesson. So about 20% of people knew that one, but again, the vast majority think that muscle soreness is okay. Americans eat much more fatty foods than they did 60 years ago. No, actually, we're lowering the number of fatty foods we eat. We are eating more carbs and more sugar, so I'm not suggesting we eat well, but we have this fear of fat, and there's been this fat-free phase, right? Buy my product because it's fat-free, and Americans are buying into this whole idea that fat is bad for you. Back in 1960, I can't remember the exact date, but in the 60s, we had 40% of our calories came from fat, and today it's 32%. So it's lower. It's not like half or anything, but we've actually lowered our fat intake as a proportion of our calories over the last 60 years. Again, only one person getting this one right. Oh, sharing a personal goal with others, such as saying, I plan to run a marathon. No, it actually decreases your chances you'll meet that goal. Saying it out loud makes it real in our brains, which makes us feel like we did it. you actually lower your motivation. You don't have that feeling of, oh, I really wish I could do this. When you say it out loud, you kind of get that feeling of accomplishment. In fact, when people say, "Ooh, good for you, you're awesome for wanting to do a marathon," a lot of times that's what we wanted. We wanted to impress somebody. If they're impressed, then boom, we're done. We don't have to actually do the marathon. So it is kind of interesting. Be very careful with your, think about why are you sharing something and what you're saying to people. With the creation of so many antidepressant medications, and there are many, dozens, over the last 70 years, Americans are much less depressed. Most of us got this one correct. Well, I don't say most, but good number. We know that this is not true. Depression rates have increased, but it is kind of interesting because part of my point of this class is that we tend to think that the medical field is somehow solving problems for us. I love the medical field. They've saved my son's life. They've done amazing things. I don't want to make it seem like I'm not a big fan, but I do think we hold them up to a pedestal. And here's an example that I think everybody can see, that the more we have drugs for something, that doesn't mean it goes away. We invented the cure for many sexually transmitted infections. Back in 1940, we invented penicillin, and we still have sexually transmitted infections, right? So having a cure, having a pill, doesn't always make something just suddenly disappear. Again, our behaviors, that's the point of this class, is that we tend to downplay the power of our behaviors in our own health. Nobody got this one right. One of the best ways to encourage healthier behaviors is through education, right? We need to tell people about the information, about the dangers of drug use, about how processed foods are not healthy, or how you should get up and move. No, actually, the more we talk about it, the more people who don't want to do it get turned off, right? This is called the backfire effect. When you tell somebody something they already know, like, ooh, smoking's bad for you, they get turned off, right? They actually feel guilty. It usually doesn't make them inspired. It makes them feel bad. And by the way, there's not too many people left. Like maybe this is true for 10-year-olds or something. Like maybe we need some information, but generally speaking, I definitely don't believe it's one of the best ways. Most of the time, giving information comes across moralistic and pejorative, and people get turned off. The best way to change a health behavior is to make sudden life changes that shock the body into a new framework. One of the worst shows in the history of all of television was a show called The Biggest Loser, where professionals, would yell at people to stop being so fat. For whatever reason, people loved this show. I'm sorry if you were one of them, but I think it was just really, really bad science, really bad for the viewers. A lot of viewers thought that, oh, that's what you need to do, is do something sudden. Research shows that's not the case. On the other hand, I will say this one is not a slam dunk. Like there is some people, maybe I'll put it that way, that some people might need to do something, hopefully not too drastic, but I do get that we kind of need a resolution. We need to really, maybe it's a New Year's resolution. We want to do something kind of like, okay, I want to do it. Because if you do something too small, too minor, right, you don't see the results, first of all, but it's also just not important enough. It's not exciting enough. So there needs to be some balance. Right now, the research does tend to show that kind of the slow and steady is better overall, like on average. But I think there are people that kind of need a little bit closer to sudden change. But absolutely, the vast, drastic changes are not good. By the way, most Biggest Losers, even the winners, but most contestants are now as heavy as they were before the show, right? So yes, they were able to lose so many pounds in such a quick amount of time, and people thought that was great. But long term, I would say it was a very unsuccessful show. It's one of the reasons it finally got pulled, is they realized they were making people unhealthier years later, maybe healthier in 3-4 months, whatever the show ran for, but just not a good idea in general to try to lose 100 pounds as fast as possible. High school students who voluntarily sign abstinence pledges are less likely to get pregnant. Oh, they're actually more likely to get pregnant. Again, this kind of gets at that whole idea of we need to inform people, right? We need to educate. Most high school students kind of know the drill, and making them sign, I am saying just voluntarily, but why would you even have them have an abstinence to sign? It's peer pressure, or it's adult pressure, I should say. It's moralistic, and it doesn't tend to change their behavior. They're actually more likely to get pregnant, not so much because we think they actually go out and try to have more sex or anything. It's just when they do have sex, they're usually not prepared. They don't have condoms or other ways to prevent the pregnancy. So they're actually a little bit more likely to end up pregnant because they believe that they're not going to do it because they signed a pledge, but it doesn't change their behavior. Obesity, almost entirely genetic. Most people got this correct. This is not true. The almost entirely is the important part. Obesity is absolutely related to genetics. I don't want to make it sound like it's not genetic at all. But if you can see this graph that suddenly percentage of people who are obese in the last 50, 45 years is just tremendously increased. That cannot be due to genetics as a whole, right? On average, as a population. If it were almost entirely genetic, this would mean that only large people are having sex with large people, and thin people are basically not having many children, right? Because it'd be the only way to kind of explain it. Clearly, what's happening is that Americans and Western countries are eating more and exercising less, and other things, processed foods, other reasons for obesity. I would say who gets obese is genetic, right? Everybody's eating more, and some of these frustratingly thin people just don't have that stay on their bodies as much, right? So we definitely differ due to genetics, but the current obesity rates is more to do with society than it does with biology. Similar to this, right? People believe, oh, I can change things. I can create my sleep patterns. I know somebody who says I only need 4 hours sleep. No, that is not true. You need at least 7. I think people who say even 6.5 are deluding themselves. We need 7 to 8 hours sleep. There's not much variability between people, not as much as people think. Did get a few, that's a pretty good number relative to some of these questions, but like a lot, I still run into people who believe, oh no, I can train myself to just need a certain amount. You can maybe for a week or two, maybe even a month, but it will catch up with you. You will have health problems as a result of lack of sleep. Placebo pills cannot change a person's actual physical, organic biology or hormones. No, it can. It can do all of these things. This is not just an illusion. This is not just an interpretation of what's happening in your body. We absolutely can change what's happening inside our bodies with our thoughts. People literally can get better, can have tissue heal better, can have their brain waves act in a certain way. I don't want to go too far by saying, we have these amazing powers with our brains, but I think this gets a little bit downplayed. And I think particularly the medical field tends to not really understand how much power the brain might have. So again, only about 23% understand that. If you don't exercise, I did put that in there. If you don't exercise currently and you go up to 5 minutes a day, that could be helpful. Most people did get that correct. Yes, you can increase your health. Not by a tremendous amount, right? 4 or 5 minutes isn't amazing, but I think you'd be surprised at how much benefit you can get from a tiny workout. The point to this question is that I do get people who say, well, if I do go to the gym, if I end up going to the gym, I better work out for like an hour. And because of that, they think, oh, I don't have an hour, I don't have the energy, I'm not going to get a good workout, so they don't bother. That's way worse. So I strongly encourage people, if you're not up for it, you don't want to do their normal thing, you're not up for the 3-mile run that you told yourself you would do, don't just sit down and give up and be like, I'm just not feeling it. Get up and walk for 5 minutes, right? If that's all you do, that's way, way better than not doing anything at all. So I worry about that attitude of, if it's not a great workout, I shouldn't bother. Hospital patients who relax and let the medical staff take care of them are more likely to have a faster recovery. No. Hospital patients who relax are more likely to have medical mistakes occur from the nurses and the doctors. They're more likely to be overprescribed, prescribed too many medications, prescribed medications that contradict one another, given bad treatments. The more you kind of take an active role in your own care, the less likely those problems are to occur. And just being more active, you're more likely to have a faster recovery if you sort of want to get the heck out of there, right? I'm not saying don't relax at all. But if you are a little bit more like, oh no, this is not a good place to be, I want to recover, I want to be done, you're actually more likely to do well with this. This is similar to that question earlier where basically said, you should anticipate your patient's needs and you'll make them live longer. Again, it's the opposite of what we think. We think that patients have to act a certain way. We think the elderly have to act a certain way, and it's counterintuitive. One of the best ways to increase human lifespans, over the next few decades is to invest heavily in medications and treatments. Well, we've been doing that. We've been doing that in droves. We spend way, way more money on the treatment of chronic problems, way more money than we do on preventing them from happening in the first place. And it is, just a saying, but it's absolutely true that an ounce of prevention is worth a pound of cure. This is what we do as society, is we wait for people to have problems and then we spend an incredible amount of money trying to cure those problems later. We would be way better off if we took more, in my opinion, a psychological approach, but even if just the medical community took more of a prevention approach as opposed to a treatment after the fact approach, we would increase human lifespans way, way more than the way we're currently doing it. And again, this did allow us to improve lifespans to some degree, but most of the rise in lifespans does not have to do with the medical community. It had to do with public health, the treatment of children, the nutrition of children over the 1900s. And again, lately, we have not been increasing lifespans, even though we're spending billions and billions of dollars. A huge proportion of our gross national product is in the healthcare community, and we're not getting many benefits from it. So that was a whirlwind tour of these 20 questions. You'll see these questions again, so that's why I'm giving you the videos. You can come back to this if you want, but you get the idea. If you total up what everybody said, we're not doing too well. This is almost chance, by the way. So my whole point, of course, is that many of these questions are counterintuitive, not what we think, and we tend to downplay the power of behavior and of the mind. Thank you for paying attention, and I look forward to seeing your comments about this video.